So if you were to ask the average consumer, what gets in the way of you making healthy choices? Number one, it's time. Number two, it's effort. And number three, it's money, right? So how can we reduce some of those barriers and make access to healthy choices easier and more frictionless by making them easy choices to make within the work setting?
Welcome, everybody, to the Navigate People First podcast. Thank you all for joining us. Please continue to subscribe and like our podcast if we are bringing value to your day. We are absolutely thrilled about today's upcoming episode and the opportunity to engage in a discussion with Robin Bouvier. Robin is one of those wonderful purpose-driven leaders and serves as vice president in Aon's Health Solutions practice located in Boston. As a valuable member of Aon's health transformation team, Robin plays a critical role in identifying and presenting opportunities for organizations to proactively enhance the health, well-being, and safety of their workforces. At this year's Navigate Summit, she delivered a compelling and inspiring presentation on women's health that really struck home with our attendees and myself included. We're excited to tap into Robin's expertise today as we gear up for 2025 and the top trends to expect in the well-being space and where organizations are focusing their efforts. Robin, thanks so much for joining us today. Excited to visit with you. Before we get started and getting into the nuts and bolts, would love for you to maybe introduce yourself to our audience and maybe just give them a little bit of background about yourself and the passion that's influenced you to where you are today.
Yeah, awesome. Thanks so much, Troy. So as you know, my name is Robin Bouvier, and I'm celebrating 25 years with Aon this year. My passion for well-being really came from my own experience because as I graduated from college, I wasn't living a healthy life, and I really didn't have the life that I wanted for myself. I felt I was overqualified for my job. I was carrying around a few extra pounds. I actually smoked cigarettes. I didn't exercise, didn't have the social life I wanted, and really just didn't like the trajectory of my future. So one day I just decided something's got to give, started exercising, started eating healthier, quit smoking. Over the course of a year, lost about 50 pounds, met my husband, got a job promotion. My life really took off. And so what I realized was I wanted to help other people live their best life and solve the problems that are most important to them. So it's not a one-size-fits-all approach, but for me, I had specific goals I wanted to achieve, and I felt so positive and empowered through my own journey and my own experience that I translated that fire in my belly over years into a career in well-being. And I've now been a dedicated well-being subject matter expert for about 12 years. And my purpose statement is to help people overcome barriers to well-being by creating exceptional environments and experiences, which is why I host great parties and why I like to bring people together and why I just get out and have my best time and live an authentic life, because I want everyone else to know that by being vulnerable, that we can all be safe together and we can all really just show up as our best every day. And so it's my personal life, but it's also my career.
Well, I love it. And congratulations on 25 years at Aon. And this is why we wanted to chat with you today, because you're good people and the things that you're doing are good for others. And as we start to think about, 2025, health insurance open enrollment season is upon us. So first off, to all of our HR friends that are out there listening, we are thinking of you. Good luck and hold strong, be resilient. But Robin, when we think about our company start planning for 2025, you and I have talked about, where's their focus at? And when we think about employers, where are they thinking about what are we seeing the opportunity for them to make and shape decisions for a better employee experience, maybe enriching the lives, protecting the lives of their employees better? How are we continually thinking about that as a crucial year is coming into play for groups?
So I think when we look at limited human and financial resources and how we can really target and prioritize where to invest those, it's always starting with the end in mind. So when we want to support our employee well-being, there has to be a why behind it. So when we talk to companies about really making those important decisions, it's always, what are the business results that matter most to your leaders? And I'll pause as a tangent and say that well-being is not an HR initiative. It's an organizational imperative. So when human resources, benefits, and well-being professionals are building out these programs, what they want to do ultimately isn't as important as the business results their leaders are going to hold them accountable for, and the reason why they will continue to invest and actively and visibly support the efforts. So we look at the data, and the top 5 outcomes that organizations are trying to achieve through their well-being efforts in order: reducing health risks, mitigating healthcare cost increases, improving employee engagement, aligning with their company purpose and mission, and retaining talent. So why support well-being in an organization? It's in order to impact those behavior changes that will drive those business results that matter most to leaders.
Robin, we're going to dig in. This is great. And so when we think about, let's just go there to improving health risks. Employers are focusing on mental health. Mental health is a top priority for employers, with some Aon numbers coming back that 72% are offering mental health benefits. What role do you see mental health initiatives playing in that improving health risks?
So I think there are 2 ways to look at mental health. The first is looking at mental health on its own, not as a comorbid condition, right? So thinking about the way people feel. I will often say people need to get their head in the game so that their body can follow. That's not always the case when we're talking about clinical behavioral health and substance use disorders. But in those areas where organizations can have an impact, thinking about the things that stress employees out and looking at the root causes of stress, whether that is work-related stress, unmanaged work stress results in burnout and people feeling disjointed and disconnected from their jobs. So those are some buzzwords that we're hearing. So helping people to manage work, whether it is being more efficient with their role, empowering them to delegate, eliminating some of those meetings that don't really need to take place and maybe communicating in more efficient ways, or allowing even artificial intelligence to take on some of those tasks that have historically been done by human beings. So as it relates to the actual work, but then also as it relates to the interpersonal relationships between the people who you work with. So having a best friend at work, for example, is a way for employees to feel not only that sense of connection, but also to really feel engaged with their employer and want to continue to work there. And having a supportive and trusting relationship with a manager. When my manager knows that I'm struggling with a personal health issue, or when I might have some elder care responsibilities, that level of flexibility and support and caring that she provides to me is way more important than any benefit or any program could be. So when we think about work stress, sometimes it's about the work, sometimes it's around the culture and the leadership and the roles of those relationships. When we think about other drivers of stress, one that comes to mind, which is a huge issue for our society, is financial well-being. Because when people are struggling with basic safety and security needs, that's the base of Maslow's hierarchy, right? So we can't expect people to go up towards self-actualization when they can barely, or maybe not at all, get through the day. So helping people to understand basic financial literacy, helping them to understand how to establish a budget, how to manage or avoid debt, and how to plan for the future. Those are levers that organizations can really pull as it relates to helping people manage stress and improve their mental health. Now, the other issue, which is so critical to the cost of healthcare, as well as those health risks, is if people are struggling with physical health conditions, many of which are preventable, a comorbid mental health condition is going to deteriorate their overall quality of life and exponentially increase the cost of healthcare associated with treating that physical condition, right? So how can we help people to manage stress by improving the foods that they eat and making sure that they're getting their nutrition needs met, improving their gut health, right? Eating whole foods. How can we help people to be more physically active? How can we help them to get a good night's sleep? Feel socially connected to other people, and also continue to challenge their minds by learning new things. So all of those things, in addition to the clinical support that are provided through benefits, can have an impact on people's brain health and their overall mental health, which then contributes again to the impact of comorbid mental health alongside physical health conditions. So I think that it's important for organizations to really think about the holistic picture. It's not just providing an employee assistance program or providing a stress management or mindfulness or meditation program. It's really looking holistically at what might be influencing the mental health or the stress that someone is experiencing, and then getting leadership buy-in in order to do something different based on driving those business results that really matter to the leaders.
So, Robin, I really appreciate how you connected the dots on the holistic side of things when it comes to improving health risks. I go back to Surgeon General Murthy called out isolationism as an epidemic in the United States, leading to stress, leading to a disconnect. How do you see isolationism, and how do you see that in an opportunity to improve health when we live in a very dispersed workforce throughout the country?
Yeah, that's a great question. I think that early in the pandemic, organizations were really looking at ways to bring people together, oftentimes in virtual environments, but being on video, having those personal conversations, but not just jumping into the work, taking a moment to talk about, how are you doing, and actually caring about the response. I think that some of that has fallen away. I mean, I personally see a lot of people who don't go on video now, and I still think it's important that we have those face-to-face interactions, but the social isolation and loneliness epidemic, it was replacing issues like smoking or sitting. It was like the next big thing that was going to have an adverse impact on individual and organizational outcomes. Because when people don't have relationships with others, it's like, we're human beings. We need to have human interaction. And when we don't have those things, it would be really easy to disengage. If I were not on video right now, you maybe wouldn't know if I was a victim of assault, or if I was crying, or if I looked like I had been up all night, if I was struggling with something. So it's having those interpersonal relationships where my baseline, and that you are willing to be vulnerable with me and ask me questions like, hey, you don't seem like yourself today. How are you? If we're experiencing social isolation and loneliness, we don't have those trusting relationships. And it's likely then that we would disengage from work, from our personal and social lives. When you don't have motivation to get off the couch, one thing leads to another, and it becomes a snowball effect. And so I think that having those interpersonal relationships is important for everyone. I would suggest the research on the youngest generation would state that it's more important for the Gen Z who are entering our workforce right now. It's more important for them to have those personal social interactions, because their lives have been disrupted at a point when they're really building those critical communication skills. And they really need motivation, not only in the form of motivation to get up and out of bed and get dressed and go someplace where they can interact with others, but also to establish those longer term relationships that are going to involve mentorship, that are going to involve opportunities for learning and education, and also to share knowledge and feel valued by others. Because when I work with a Gen Z person in the office, I'm often saying things like, you have more technical skills than I have, and I really want to lean into you and help you feel valued and appreciated for what you bring to the workforce. And then I'm willing to share thought leadership with you so that you feel like you're getting what you need. If we don't have those opportunities for interpersonal relationships, I think that it's a missed opportunity for people both personally and professionally.
We're a vendor. We get to work with Aon as a vendor, and as a vendor, we're trying to establish trust and being able to see each other. I miss the finalist meetings. I miss the on-site finalist meetings. They're starting to come back. I do like those. Being able just to establish trust and understand that we're trying to bring value across not only to the employees but to the HR folks that are out there, and making connection with them, because you're putting us into your workforce. You're utilizing our software for your employee engagement, your experience. That's a big deal when it comes to matching up with your culture. And so when we talk about healthcare costs, reducing healthcare costs as a top 5 focus as well. The average cost of employer-sponsored healthcare coverage in the U.S. is expected to increase by 9% in 2025. And even in that middle market, you're looking at increases between 14 and 18%. And so when we think about that, what are you seeing trend-wise? Are you seeing more focus on prevention? Are you seeing more focus on looking at strategies, addressing obesity, GLP-1s? What are you seeing, Robin, in that space?
So the numbers that you're stating are aligned with our actuarial projections around a 9% increase in 2025. And this is a serious problem for organizations. And so they're throwing their hands up in the air saying, what can I do? And the fact is, there are some things that we can't control. So we try to focus on those areas where we can use data in order to drive better decision making. And we recommend a prevention, risk reduction, treatment framework, right? So prevention is, how can we keep healthy people healthy? How can we prevent them from getting sick or delay the onset of age-related conditions? That might be everything from physical, social, emotional, financial, and work-life well-being, all of which are interrelated, right? So focusing on keeping people wholly well through that multidimensional well-being approach. It's also making sure that people have a relationship with a primary care doctor, that they have someone who can coordinate and quarterback their care so that when they need to enter the healthcare system, they will have the ability to do that without being overwhelmed by the complexity. So it's, how can we reduce friction when people need to go into the healthcare system? Sometimes it's recognizing that there are work-related barriers or financial or access barriers that might prevent somebody from getting the care that they need. So really making sure that services are available in a remote or virtual type of setting, or maybe helping an organization to bring on-site resources into the work setting so they can connect people with care and eliminate some of those barriers. Some of it also is basic health literacy, because if employees don't really know what a healthy life looks like, what they should be doing on a day-to-day basis in order to stay healthy, helping to educate and engage people in that way. I mean, I know we as human beings make decisions based on our feelings because we are human and we are emotional. We are not rational, right? So all the education in the world isn't necessarily going to change somebody's behavior. But if we can at least create a trusting relationship with someone who then creates a teachable moment to meet somebody where they are. One of my favorite stories actually comes from a coaching setting that I heard about. And in the setting, a gentleman presented for a coaching session, and the coach basically said, well, all of your biometrics are in healthy ranges, and it looks like you're doing a really great job managing your stress. And the gentleman said, yeah, but I smoke. And she said, well, that's okay, because everything else that I'm testing for is in a healthy range. And he was like, but yeah, I smoke. And she said, well, let's talk a little bit about that. And what she learned through that conversation was that he actually felt shame about his use of tobacco, and it was causing distress in his marriage because his spouse said, I don't like that you smoke. And so by presenting that during that relationship of trust with a coach where they were talking about prevention, he said, I would really like to make this change in my life. And so he began a tobacco cessation journey, right? So it's the trust as well as the data, and then really helping people to identify what they are intrinsically motivated to do in order to live their best life. So I kind of think about that holistically as prevention. Risk reduction. So when someone has an accident or an injury, or someone has an illness and they need to enter the healthcare system, how can we help them to navigate, again, using that primary care doctor, but also understanding as a consumer that as healthcare costs go up for our employer, it's not an unlimited pool of funds to pay for healthcare benefits, right? If an employer has a pie and they have to break pieces of that pie up in order to pay paychecks and cover the cost of benefits and do other things that employees want, if one piece of the pie gets bigger, it means the others get smaller, right? So what can we do as consumers to make good decisions around when, where, and how we access healthcare? So from that perspective, it might be getting folks to use generic medications when they're available, or making lifestyle behavior changes to the extent possible before purchasing a high cost drug like a GLP-1, for example. I acknowledge that some people might struggle with weight loss through just traditional behavior change, and those weight loss drugs can have a huge impact. But if we don't get our heads in the game, our bodies will not follow. So really thinking as a consumer, what can I do that will reduce the cost of healthcare, but that will also bring me a better quality of life? That applies across the entire healthcare spectrum. So whether it is prescription drugs or seeing a specialist instead of seeing a primary care doctor, going to the emergency room instead of an urgent care center or a doctor's office, having a high cost radiology visit at a hospital instead of a freestanding facility, right? These are decisions that a consumer can make when they have the right education, and they have a trusted person to help guide them through the process. The final step of this equation at Aon, we've got the prevention, risk reduction, and treatment. Treatment is where the majority of the dollars are spent. But about 86% of health plan dollars are spent on people who have complex and chronic conditions, many of which are preventable. So about 80% of type 2 diabetes and about 80% of heart disease are preventable, right? Through preventive screenings and services, as well as healthy lifestyles. About 40% of cancers are preventable. So if we could get folks to quit smoking, to watch the time that they spend out in the sun, to reduce use of alcohol, to really manage their weight, we could reduce the incidence and severity of many types of cancers. And these are the types of conditions that are driving costs for employers. So mitigating those through behavior change can have a big impact. Something else that we consider is if you go to a back surgeon and your back hurts, what's the surgeon going to say? Well, of course, I'll give you surgery, right? That's what pays for my golf club membership. That's what's going to fund my retirement. If we go into a store and say, I want to buy something, the salesperson is going to sell that thing to us. But if we understand that there are less invasive alternatives, kind of like a step therapy approach, before we go in for an elective surgical procedure, not only is it going to improve our quality of life because we'll be less likely to get an infection, less likely to be hospitalized associated with complications, and it will also improve and reduce the duration of our recovery. So, there are certain things within that healthcare equation that we can't impact, but where we can, that's really where well-being and engaging people as consumers and educating and empowering them to have an impact on their individual outcomes and their individual quality of life, which I think is going to translate into our ability to mitigate healthcare cost increases. Aon's also doing a lot with data to help our clients understand, who's at risk of being a future large claimant. What types of predictive models can we apply to identify people where we may want to proactively intervene? What are some of the things that we could do to close gaps in care as it relates to evidence-based care guidelines for treatment of certain types of conditions, right? So there are lots of ways that we can use the data, and it's really about meeting the employer where they are, using, their problems as a motivator and an influencer of the recommendations that we make so that we can help them really to drive the business results that matter most.
I want to go back to on the personalization side of things you're going with. It's interesting with the majority of U.S. employers plan to maintain their current benefits in 2025. We've seen that within, launching our programs with our clients this year, despite the rising healthcare costs. I think that goes back to being able to kind of utilize data for good and really personalize and prioritize for our employees. that's part of employee engagement, right? And so when we look at that, you'd mentioned earlier too, just like listening sometimes is the best medicine. And so as we're listening to employees and we're able to personalize things for them, we're engaging them in a manner that is in growing importance when it comes to health and well-being, especially if you look at we're integrating well-being into our company culture and our overall business strategy. All these things add up that overall strategy. So maybe touch on a little bit, Robin, how when you think about the culture and the mission of an organization, how is Aon aligning that talent, health, wealth, and that risk, development of a program together to kind of add that as like our fourth focus factor of 2025?
Yeah. So at Aon, we are really divided into two divisions, and one is risk. And within risk, we're talking about things like safety and workers' comp, which do have a human implication. Within our human capital practice, we have health, wealth, and talent. And those are all really employee-centric focus areas. When we look at an organization's data, our goal is to deliver Aon in a united way so we can help organizations look holistically at the risk associated with managing a human employee population, creating a culture, an environment, and a supportive community that will help to make the programs more successful is one of the areas where we really specialize. Because you can have all of the programs in the world that might engage people in behavior change. But if an employee can't get away from their workstation in order to participate, or if their workload is so packed that they don't have time, maybe they're struggling financially. And so they have to grab fast food on their way home because they don't perceive that they, have the resources in order to invest in healthy food choices, or maybe they don't feel like they can afford to join a gym, right? Creating an environment that helps to address the top three barriers to well-being success is really where the magic happens. So if you were to ask the average consumer, what gets in the way of you making healthy choices? Number one, it's time. Number two, it's effort. And number three, it's money, right? So how can we reduce some of those barriers and make access to healthy choices easier and more frictionless by making them easy choices to make within the work setting?
Creating that positive work environment leads to the engagement. It leads to, looking at ways that we're investing in our employees' well-being and organization to improve productivity, reduce turnover. When you think about the recruiting and retaining, how do you see that healthcare strategy improving potentially recruitment and retention? Because there seems to be a balancing act going on right now. There's a balancing of costs versus a balancing of benefits, and just making sure that even though we're seeing increased healthcare costs, we're needing to also attract and retain, our people with attractive benefit packages in those strategic investments. Where are you maybe seeing that play in the recruiting and retention factor?
So I would suggest that employee engagement is based on the research right now. It's coming out of Gallup and other sources. It's at an all-time low, right? So the ratio of actively engaged employees to actively disengaged employees is about 1.8 to 1, which means that for every 1.8 people who are rowing the boat and trying to head the ship in the right direction, you've got one person that's actively trying to capsize it, right? So the role of not only benefits, but of supportive leadership and an environment where people have the ability to live a healthy lifestyle has a huge impact on employee engagement, right? So when we have a high employee net promoter score, it means that in the world around us, employees are saying through their words and actions, this is a great place to work. I recommend my employer as someplace for other people to look for a job. Through their words and their actions, they also perform better when they're highly engaged. And companies that perform better create a better experience for employees because they have more resources then to invest in the services that employees want. An organization that's struggling financially is trying to get blood from a stone in order to pay for some of the bare minimum benefits. But an organization that's rich in cash and assets is more likely to be able to influence the experience of employees by investing more in well-being and in some of the bells and whistles that other companies maybe don't. So I think that there's a direct alignment between employee engagement and retention of talent. And then when employees are happy with their organization, not only will they stay when given the opportunity to leave, but they will also recommend their organization. They will recruit other people, bring them in, and then create an environment where those employees want to stay as well. So it becomes a bit of a virtuous cycle. And it's really influenced not just by the benefits in the programs, but by that supportive culture, and by the environment that makes healthy choices easy, accessible, and affordable for employees.
Which then goes back again, as we talked about, emphasizing the importance of integrating the well-being into the company culture and the overall business strategy. So when we think about reducing healthcare costs, we think about improving health risks, we think about employee engagement, culture and mission, and recruiting and retaining. Those focus five right now, I look at that and say, it's encouraging. We're promoting health and well-being. We're connecting all these things together. When you think about using data for good and all the data that we have and the analytics to benchmark against, where are you seeing folks optimize that investment when it comes to using data to make decisions, when it comes to tighter budgets, maybe looking at the value that vendors are bringing? Maybe touch on that a little bit, Robin, of what you're seeing coming into fruition for 2025.
Budgets are a little tight right now in our economy. And so when organizations are saying, not only do I not have a lot of money to spend, but I don't have a lot of people to do the work. I've got a lean team. And how can we really prioritize where we're going to be investing our time and resources? A couple of things that I would recommend to an organization: always start with the end in mind. If you know the business results that your leaders are holding you accountable for, focus your efforts on the behavior changes and interventions that are going to help you to achieve those business results. Because when the business is performing better, there are more resources that will be freeing up in order to invest in those programs and interventions. And so creating momentum with some early wins and really focusing on those business results. The second thing that I would recommend is tapping into the trusting relationship and intrinsic motivation. So if my employer were to offer a program based on what they thought I wanted, or to offer me something based on what they want me to want, right? What I need is what they want me to want. But I'm an emotional person and I want what I want, something that makes me feel better or something that makes me feel less bad, right? Feelings drive results. So if my employer were to ask me, in what areas of your life are you struggling? And where would you want help from your employer in order to address that issue? Targeting the employee-facing initiatives at those areas where employees really want help is what creates that trusting virtuous cycle. So if you ask me for feedback, I provide it to you. You say, thank you. Thank you for trusting us. Thank you for sharing this information. Here's what we learned. Here's what we're going to do. You do it, and then you tell them what you did and help them to understand how all of your employer actions were influenced by the feedback that you got from your employees. That starts to build more and more trust. And when you do it on an ongoing basis, not only it helps you to prioritize where you're investing your time and resources, but it creates an environment where employees actually feel cared for and supported. That's what we're going for, is feeling cared for and supported, whatever that means on a personal level. About 1 in 5 employees in the US right now feels that their employer truly cares about their total well-being, right? That's not okay. Employers are offering amazing programs and resources. Employees may or may not know about them, but more importantly, they don't feel those programs were designed for them. They don't feel like those programs are what they want. If they were to break up that employer pie and invest in specific things, maybe they wouldn't choose those specific programs or interventions, right? So why don't employees participate? It's because they don't feel like they are cared for and supported in a way that has, been informed by data about what they actually want. So I think that, that's really the approach that I would suggest around creating trust is by using that data from employees in order to really target the investment and make sure that you are not throwing programs and resources at a problem, but actually, taking a very strategic approach and prioritizing not only your budget, but your human resources in that way.
Yeah, and that personalized approach, I think that we're very very happy and excited to be a part of the strategic middle market opportunities with Aon that we're working with you on, and that strategy moving forward, and that total health personalization opportunity to create those pathways for those individuals really connects back to listening, the culture, the care, all of those things, kind of bringing that together. I know you spend a lot of time in the middle market and working there. When I think about mid-market, mid-size organizations, they're experiencing significant growth in the United States. That accompanies, some unique challenges and opportunities when it comes to the realms of risk and human capital. What are you experiencing now when you're seeing these mid-sized companies, middle market companies growing, and the with that significant growth and the things that are accompanying with that when it comes to risk and increase employees and costs?
So in the mid-market in particular, I think that the buying style can be very different. I find that my middle market customers are more likely to say, you know what, I really want you to make a targeted recommendation and tell me what to do because I'm wearing so many different hats. I've got a lean team. I don't have the time necessarily to do the research and take on a lot of effort. And so I find that being prescriptive in the middle market really makes a big difference. I also find that in that environment, when I have to be prescriptive, what an employee is experiencing at the end user level needs to be really personalized. Because if the organization only has a limited bandwidth to implement a program or a resource, making sure that when the employee is engaging, they feel that it is personalized to them, that it's addressing the issues that are most relevant to them, that it's available on their schedule, on demand, as opposed to, what we used to do in the past. Everybody could go to a lunch and learn. Well, who wants to give up their lunch hour when they were already working through their lunch hour in the first place so they could get home to pick up their kid from daycare or to go to the grocery store for an elderly parent, right? So we have already given up so much. And so I think that level of flexibility and customization and personalization on the individual level is something that I'm recommending from a prescriptive perspective. I also often will cut to the chase for an organization that says, I really don't know what I want to focus on. There are two key business results that I tend to address with my middle market well-being. One is mitigating healthcare cost increases via reducing health risks. And the other is really focusing on driving a better employee experience, improving engagement, and the ability to retain top talent. Those two objectives really kind of summarize the top 5 for organizations, but it simplifies it for the employer. I'm not giving them a choice of 5. I'm saying these are the 2 things we're going to focus on. Let's figure out if one of them is a bigger priority than the other. And if you want to start small and take some baby steps, because I know in middle market, if we don't have a lot of resources, we can't always put in a full-fledged program. So we might have to start small. So really helping the organization to focus on the things that matter most. And when we're talking about mitigating healthcare cost increases and reducing health risks, there are 4 key behaviors I always recommend. Helping people to eat better, manage their stress, move more from a physical perspective and make sure people are getting their preventive screenings, and then help people to sleep better and encourage self-care. Self-care is not selfish. Self-care is what we do when we're on an airplane and the oxygen mask drops. We put on our own oxygen mask before helping others. We need to make sure that we are taking care of ourselves and showing up as our best self in order to be there to help others. And for HR benefits and well-being counterparts across the employer space, these folks spend their lives helping other people. So one of the areas where I'm really focusing with my clients is encouraging self-care. We are all busy people. So how do we manage our energy better? And how can I help you to prioritize what's important to you as a person so that you can bring your best self to your work. So those are really some of the, I would say, some of the key areas, again, where I'm working with middle market. So really being prescriptive about what to do, making decision making easy around not only business results, but behavior changes, but also making sure that you're taking care of yourself. Because we are emotional and we make decisions based on feelings, if I experience something and I feel better because of it, I'm more likely to advocate to roll out that program to my entire employee population. So it's also kind of like a guinea pig type of approach, because if I'm going to introduce something that makes you feel good, then you're more likely to tell two friends and they'll tell two friends. And that starts to really create a little bit more of a groundswell of participation and engagement by folks, simply because if everybody's doing it and it's the cultural norm, it starts to feel like it's, the socially acceptable and really supported and encouraged within the organization.
Robin, we're so grateful for you to take the time and provide your insights and your experience on this. I tell you, when employers, are adopting these proactive strategies and help manage healthcare costs, improve employee well-being, it comes down to caring for your folks, creating a great culture, coaching where we can, and then obviously reevaluating, connecting the dots when it comes to listening to our employees. Bringing that together creates a healthy culture and a healthy, productive workforce. And then most importantly, it creates trust. And that's what we're trying to do. Thank you for today, Robin. This has been wonderful. We have one final segment. It's the best day ever. We end our segments with a good. So give us a best day ever, or give us a good that's happening in your life. What's going on?
I would like to share a moment of gratitude. I may have mentioned that I have two elderly parents and they're currently living with me, and my mom has dementia. So earlier this week, I put my parents in a car and drove them from Ohio to Massachusetts. And my mom was sitting with me in the front seat, holding a stuffed dog, talking to it, petting it. And about 10 hours into our 12-hour trip, I noticed that she was starting to experience the sundown effect. She was getting quiet, a little bit less engaged in the conversation that I was having with my dad in the back seat. So I changed the music so that it was something a little bit more upbeat. And I gave her a little bongo drum, which we got on a family cruise a few years ago. That was really the last time she was able to take a vacation. So I have a lot of memories associated with her walking around and just playing this drum. And she sat there in the car for about an hour, and she just tapped her fingers and tapped her palm of her hand on the top of that bongo drum. And I actually took my phone at one point and I made a video of it. And when I arrived, my sister sent me a text message and said, "You're a rock star." And I said, "No, actually, Mom's the rock star." And I was able to share that video, but I'm never going to get these moments back. And so if I could send a message that we need to really be grateful for the moments that we have, the moments that matter, the moments where we can make somebody else's life better, and that we can share that, right, in a very virtuous way, in order to help people understand that, we've really got it good here. And they're just, we only get one go around. So if we have the opportunity to just be grateful and feel positive, even when things in life are going wrong or seem really tough, I think that helps to build resilience and really helps us to recognize the impact that we can have.
That is a wonderful good. And thank you for sharing that. Memorable moments matter. And I think your experience in the last few years of what you're doing every single day for so many different employees might have helped you on that car ride. So well done. That's wonderful. I'm going to end up with my good is, building a foundation of a culture is tough. But once you build that foundation, you build upon it. It's something that you're very proud of, and you see the ripple effect of that. And I'm just so happy. This past week, we were able to contribute to Habitat for Humanity, and a Navigate crew went out all throughout the country, and specifically also in Des Moines. And we helped build the foundation of a house that will be, the front door will go on here in about a week. But just seeing everyone dig in, the teamwork, it was hard work. It was getting that together and doing all those things. And nobody got hurt, which is great. There was some nails flying every now and then, but in the end, building that house for the family that was actually there with us too, helping us along that build was just something of a wonderful experience. The foundation of doing good at Navigate. And that's my best day. That was just a wonderful time. And again, nobody was hurt. It was great. We all had fun. They celebrated that. And it was just a great opportunity for us to give back. So, Robin, thank you for giving back today of your time and your insights and your experience to our listeners. We are grateful. We're grateful for our relationship with Aon as we move forward. And I also have a green Navigate hat coming your way, the Celtic Pride over there in Boston. So thank you for everything that you do for others. And thanks for being part of the People First podcast. Everybody's listening, please give us a review. Please give us suggestions. Please continue to subscribe. And we appreciate everyone out there in HR, all of our folks here at Navigate. Thank you for what you do for others every single day. And let's keep going. See you, everybody. Bye-bye.